Q, you ready? Okay. Good morning.
Good morning.
Welcome to the Future of Family Benefits session. Good morning, Hannah.
Good morning, Gina.
Yeah, we're glad that you could join us today. We're going to talk about how you can provide family-friendly benefits in an era of rising healthcare costs. Introductions, Hannah, if you want to spend a little bit of time introducing yourself.
Sure. My name is Hannah Wilkowski. I'm the Global Benefits Manager at Buzzfeed. I'm very happy to be here today. For those of you who are live streaming and, of course, who are physically here, thank you for coming.
Yeah, thank you. I'm Gina Bartasi, the founder and CEO of Kindbody. Kindbody is my third startup in the women's health and fertility space. My previous startup was Progeny, which went public in October. And prior to Progeny, I had Fertility Authority. So we'll talk a little bit about the differences, what we heard from large employers and patients. And again, today's session is on meeting today's modern workforce and how you add a benefit and still save money. This is about Buzzfeed, if you want to talk about the workforce at Buzzfeed.
Mm-hmm. So Buzzfeed is primarily female. It's about a 60-40 split. We are very heavily millennial based, as I'm sure you might be aware. Our employees are very smart, very aware of what's happening in the world, in the news, and they're definitely not the type to shy away from providing feedback on anything, but particularly benefits. So it makes my job very exciting.
Great. And here's a little introductory video on Kindbody.
We believe that going to the doctor should feel like a visit with a trusted friend, where you can get all the care you need in one place, where your health care is within reach at all times, in person or online, where the quality is high but the costs are low. We believe that your job should offer family-building benefits for everyone. Introducing Kindbody, a new generation of women's health and fertility care with a redesigned patient experience that's accessible and intuitive, with everything you need under one roof, from preconception through postpartum care. At Kindbody, we're on a mission to make these services more convenient, comfortable, and affordable for all. With clinics around the country, virtual and mobile services, we are dedicated to delivering compassionate care wherever and whenever you need us. Our goal is to make sure everyone gets the best possible care at the lowest possible costs. We are the doctors. We are the clinics. We are your end-to-end family-building solution.
Thank you. Let's jump right into the heart of the discussion, Hannah. Tell me a little bit about what you hear and what the top requests are from your employees.
This is, like I mentioned before, one of the reasons why I will never be bored at work. We get a lot of requests, some really fun ones. So requests can range from on-site yoga to on-site haircuts, all the way to different type of leave programs. We take each and every request very seriously, whether it comes in the form of a discussion. So we oftentimes meet with different individuals throughout the company, throughout the world, different teams, different employee resource groups, to really get a feel for how they're doing, more like of a temperature feel. So is there a gap anywhere that they perceive? Once we kind of understand how they're feeling, we go off and we do a lot of research. We read articles, we go to our brokers for more data, we survey even more employees, and then we kind of take a look and see, okay, well actually, their point is valid. We are missing this, and it would touch a lot of employees' lives and enhance their time here at Buzzfeed, whether it's at home or in the office. And then we kind of work towards finding the right vendor and implementing.
Great. And talk to us about Buzzfeed's goals as it relates to 2020. What is some of that feedback you heard from your colleagues, your members? So talk about a request for 2020 and anything that's on the horizon for 2021.
Mm-hmm. So while I wouldn't say there is anything currently in particular we're focusing more on than anything else, I would say that continuing to seek that feedback is the most important thing we can do. All of our benefits, a lot of our benefits are there because of feedback. So we have a really robust mental health program, and that's because we received feedback from one of our groups that they felt we were lacking in it. So we went off and we implemented Ginger, and now it's all across the globe and people utilize it when they need to. It's also in the form of educational sessions. So a few people mentioned that either they weren't aware of something or they had the same type of questions over and over. So we said, well, they're asking these questions because they don't know. And if more than one person, if a whole slew of people don't know something, it's because we're not educating them correctly. So we went off and now we have different education workshops and seminars and webinars. Right now, definitely webinars, not workshops. And then also, and I guess more relevant is our parent benefits. So we have a parent ERG, and it's really important for us to be able to communicate with the parents, new parents especially, at Buzzfeed, because one of our biggest populations is millennials who are new to the family or parenting world. A lot of our readers are also new to the family or parenting world as millennials. So we think it's important that we communicate with them from a place of authenticity. So what better way to be able to do that than to kind of go out and say, okay, well, you're in the workforce, you're employees, and you're new parents. So how is it going? What are you missing? What's great? What's working? What's not working? So that actually led to our increasing and having a pretty robust parent benefits package, which goes from 18 weeks of primary caregiver leave, yes, 18 weeks, it's amazing, to pregnancy resources through Maven, through backup childcare, through care.com, and most recently, everything up through conception through Kindbody. And it was equally important to reach those individuals as well, because really when you think about being a parent, it's everything through pregnancy, through like having the baby and raising the baby. It's everything to get to that point. And that was kind of an area that we hadn't really looked into or delved into beforehand. So I'll get into the story later about how we even discovered Kindbody, but it has been a really great journey since we rolled it out on January 1st.
Yeah, thanks, Hannah. I think you are seeing that with millennials today. Historically, when we thought about family benefits and fertility benefits, the fertility journey was very reactive. You really had to be diagnosed as infertile instead of fertile. And we know it's very, very difficult for doctors to be able to help and create, once you're diagnosed as infertile, it's hard to make you fertile. And so the millennial employee population that we're seeing is it's a change. They are being very proactive, whether that's egg freezing or embryo freezing. But it is I've seen over the last 10 years how members think differently about being proactive about their reproductive health instead of historically it was very reactive. So it allows members to surface those needs and desires to HR executives.
I also think it's a good point, but it's even how we coined the term infertility or infertile. And I think even shifting it from infertility to just fertility benefits is such a major just like cognitive change. So instead of kind of this negative connotation with the term infertile, we're now calling it fertility benefits, because what can we do to help you get there?
Yeah, I think that's right. There's a number of changes we've seen over the last decade as it relates to family building and fertility benefits. Healthcare as a whole, you're seeing more and more employers move from a fully insured to a self-insured. The second thing that we've seen over the last decade, and particularly so after the last 5 years, is a move from this fee-for-service to a value-based bundled case rate. Again, the majority of healthcare today is fee-for-service on these various CPT codes, whether it's the payer community, the employer community, or the member community. They all hate being nickeled and dimed, and that's a worse word for fee-for-service, but that's what happens when you get these individual bills. Members often get invoices after the fact. And so in addition to more and more employers moving from fully insured to self-insured, the second thing we're seeing is moving from this fee-for-service to a value-based bundled case rate, so you don't get any of these miscellaneous bills and nickel and diming. The third thing that we've heard from employers time and time again is the desire to buy services direct from the doctor, particularly when you're in a high-cost service area like fertility. We see it musculoskeletal, you see it in cancer treatment, where you have a small utilization of your total member population but a high expense. You see employers requesting to purchase benefits directly. So again, a lot of movement in healthcare as it relates to family and fertility related benefits, but driven by the employers today. Not so much, the payers are catching up, but really this movement to direct contracting and a value-based case rates driven by the employers as more and more employers pay for the healthcare costs in this country. I think what employers are seeing is healthcare cost is rising at a rapid rate, in some cases 24% year over year. Their healthcare costs are increasing, but they're not able to really exactly point to an increase of 24% in benefits, and the member population is not 24% happier, and so the employers really are asking some hard questions.
Mm-hmm. It's true, and just for a personal anecdote, I had foot surgery in October, so not family benefits, but I went to the doctor, I went to the hospital, I had the anesthesiologist put me under, and then it took 5 months to stop getting bills. Had I had a bundled or value case situation, it would have been such an easier and more relaxed experience. Instead, I was kind of going through multiple parties. So I was going through the actual doctor because they were out of network. I was going through my health insurance company. I was going through the hospital. I was going through the anesthesiologist, getting all these bills and trying to coordinate them. And let me tell you, having something like Kindbody, which has that value-based rate, is amazing. Be able to tell employees, no, it's only going to cost you X amount of money to freeze your eggs or for IUI or IVF. It is so relieving that they don't have to kind of hold their breath to see what other bills come in the mail. They know what they get and how much they're going to have to spend to get it, and there are no other questions. That value-based rate, that egg freezing includes everything up until the egg freezing, including blood tests, including all the checkups beforehand. So it is such an amazing breath of fresh air, and I'm so excited to be able to tell employees about that and kind of alleviate that additional stressor, because the last thing they need when they're going through fertility benefits is anything to add stress onto that.
Yeah. Thanks, Hannah. Mm-hmm. Tell us about kind of the benefits offering and what you think sets Buzzfeed apart from kind of other media companies, mm-hmm. And other like-minded employers.
Mm-hmm. I think what's actually important to kind of discuss when it comes to this question is not only the benefits that we offer, but more so how we get to that place. I mentioned before that my colleague Noelle and I, we never shy away from talking to employees, or sometimes it's really just listening to employees talk about how they're feeling, what their benefits are, what the perceived gap in benefits is. Oftentimes when there's a perceived gap in benefits, it's because they're just not aware that we actually do offer something, or one of our carriers offers that resource, so it's educating. So a few things happen when we have those conversations and receive that feedback. What first thing is, well, do we actually have that benefit and they're just not aware of it? If it's yes, amazing, my favorite thing in the world. If it's no, okay, well, let's think about this even more. Is this something that is truly a gap in our benefits and multiple employees would benefit from and their lives would be enhanced from? Yes, actually. Okay, so then let's go ahead and survey even more employees to see really what that means, what that full benefit package would mean to them. We then go out to our brokers. We do a lot of different sourcing and RFIs to just see or ensure that we're getting the best value for the benefits that we bring on, and we'll touch the most amount of employees, even if it's not directly impacting them right now. Can it actually kind of broaden and help other employees as well? Once we get to that point, once we meet the vendors and make a decision, we go off and implement. So I think what's important, and then I'll talk about why I think we actually do have really good benefits, is we get to that point because we listen. And I think that's going to be a bigger and bigger shift in employee relationships as we kind of move forward and millennials start entering the workforce more and more. I think our parent benefits, though, really do differentiate us in the industry. And that, as I mentioned before, is a direct result of the feedback that we received over the past 2 or 3 years. It didn't happen overnight. It didn't all happen when I was at Buzzfeed. It happened before me too. But it's been a major shift, and I'm really proud of where we are today. As I mentioned before, we have an 18-week primary caregiver leave. That's 4.5 months of fully paid leave for primary caregivers. We have Kindbody, which helps employees up until conception, and even if they're not ready to conceive quite yet, if it's for people who are and are not ready to start a family. So whether that means someone's brand new to New York City and just needs a brand new gynecologist, we have that for you at Buzzfeed. Well, yes, Buzzfeed, but through Kindbody. If someone's wanting to have a family but not quite yet, we have egg freezing now, and we have the value-based rate. So you know exactly what's going to cost at a discounted rate through Buzzfeed. If someone is trying to have a family and maybe is having a hard time, well, we have that too for you. So I think it's really important that we kind of touch all employees, or as many employees as possible.
Yeah, thank you. I think so. You know, we mentioned it earlier, but this new initiative, relatively new, you are seeing it in some, again, MSK oncology related disease. Fertility has been diagnosed, or infertility has been diagnosed as, or acknowledged by the World Health Organization as a disease. But again, this ability to purchase direct and save enormous cost, because when you look at the cost related to onco or musculoskeletal or fertility, the question really should be is, why does it cost so much? I will tell you, we are in the doctor business now. We can control for cost. Only 3 things matter in healthcare: patient experience, patient outcome, and cost. And you have to be in the doctor to effectuate change. You mentioned when you went in for your foot surgery, you had to call your insurance carrier, the doctor, that, you know, all of these respective different parties. What's happening in healthcare is we're going to go back to the way healthcare used to be, which is putting the payer, the patient, directly in touch with the doctor. And we think, well, we know we can drive down cost and still get an extraordinary patient experience at a lower rate by purchasing direct. Fertility is expensive. In New York City and San Francisco, in the more metropolitan areas, on a national average, fertility IVF will cost you $22,000. An elective egg freezing benefit will cost you about $9,000 or $10,000. And the question is why? It's because historically fertility has been a cash paying. It was historically, fertility was for a very low member population. What's happened over the last decade as more and more women and men wait to get married and wait to conceive, you had this cottage industry that's actually growing very, very rapidly at double-digit rates. And it has more to do with the macroeconomic trends of couples and single individuals waiting to get married. You see high growth in LGBTQ patient populations now seeking children. And so what's happening is you are having more and more coverage by managed care, and the carriers are actually helping to drive down costs. Now, the challenge with the carriers, and I do think they're starting to change, but the challenge with the carriers is this fee-for-service program, and they also have a pre-authorization. And so at Kindbody, we've moved from the fee-for-service to a value-based case rate, and again, we're allowing the employers to buy services directly from the doctors. What that means is an egg freezing rate, if you were to go on the open market in a major metropolitan or even a kind of a medium-sized city, again, egg freezing is $9,000 to $10,000. When you buy services direct through the employer population, it's $5,200. Yeah. So there's quite a bit of affordability. Last year at the conference board, we heard that from a number of employers. They were looking to add an egg freezing benefit because even if they were fully insured, in New York, you have a brand new mandate that now covers 4.7 million new New Yorkers. Mm-hmm. So if you are a commercially insured, a fully insured employer, and you have more than 100 employees, by law, you now must have to provide to your employee population 3 IVF cycles. We anticipate more and more coverage. We know there's a similar bill on the governor's desk in California. And so again, you do see these employers and the carriers try and build and serve this member population. The question is, how do we get a handle on cost? And you also talked about really listening to the Buzzfeed members and understanding where you had a gap in coverage. And I think you heard from your member population that they wanted to add an egg freezing benefit. Right. 5 years ago, when egg freezing for a member population was relatively new, there was quite a bit of criticism to the early adopters. And we helped, I think, the media and other employers and the carriers and kind of the general public understand that adding an egg freezing benefit is not coming from the top down. It's not the HR, the CHRO saying, we want to add an egg freezing benefit. There was a lot of speculation by the media, aren't we chaining women to their desk? It's actually the exact opposite and the reverse of that, where it's stemming from the member population. Is that what you've seen, Hannah?
Definitely. So one of the best responses, plural, that I've received from once I've rolled out Kindbody was everyone who came forward to say that either they had recently decided to freeze their eggs or look into it or plan on doing it in the near future. And that they're so happy that we were able to roll out Kindbody and provide that. A lot of people are also kind of disappointed it took so long for us to roll out something like Kindbody, because what I didn't realize, and which is a little sad, that so many people were going through this alone and didn't come forward to say something about the actual egg freezing part and how they wanted to do it. And looking back, they probably felt very unsupported. Being able to go out and roll this out and saying there's something here for almost everyone, take a look. We have discounted rates. You know, it's 3 blocks away from our New York City office, and it's a few blocks away, or it's very close to our other locations around the U.S. Being able to roll that out and say, we have something for you. And whether it's something you've been thinking about or just want to ask questions, there's a dedicated line at Kindbody that our members have certainly reached out to utilize to get more information, whether it's just about when can I come in, what does this mean, what does this cover. So receiving that feedback was amazing, and certainly it kind of makes me really open my eyes to all the different types of people and their needs, and continue getting that feedback.
Yeah, and we heard that. I mean, again, I have the benefit of having kind of a 10-year head start in the fertility industry to build around exactly that, member feedback and employer feedback. And I think one of the things we know about healthcare today is this consumerism of healthcare. Our locations are retail in nature, close to the Buzzfeed offices in San Francisco, Los Angeles, and New York. Certainly we have another 72 locations around the country to ensure that even after you identify gap in coverage and you offer egg freezing, to make sure there are no gaps in coverage from a census standpoint, being able to help remote employees in kind of the middle part of the country. So we have a network of doctors that really solves for that pain point as well. So.
And it's amazing. And also I think what's important to note, which you might have seen in the video, I definitely recalled it from my visit to Kindbody, was that the doctors don't wear white lab coats, which so often is just intimidating. And more also, there are no diplomas or certificates on the wall, because they're a doctor. They don't need to prove time and time again that they're a doctor. Instead, they come, they're dressed nicely, they're so patient. So when I went, I was surprised by how not only patient but human the doctor was for me. She kind of sat me down at a table similar to this, and she walked me through everything I could ever have wanted to know about fertility and conception and everything up until that point, what does or does not happen. And then all the questions I had, she answered as a human, and she was speaking to a human, and I felt so heard. And it was such a great feeling that I walked out saying, wow, we really need to implement this benefit. To kind of back up, how we even found Kindbody to start is actually through my colleague, my employee, Noelle, who was walking to work one day and passed Kindbody and said, wow, this is great. This is something that actually might work really well at Buzzfeed. So, we looked into it. We had a few meetings at the Kindbody office. Went back for fertility assessments to kind of get a lay of the land, because we would never implement a benefit without thoroughly testing it out first, which usually works out pretty well for us, I'll say. So afterwards, we walked out and we both looked at each other and were like, that was amazing. Like, that was beyond what we really could have even ever expected from a fertility place. And then we realized, of course, there's so much more than just fertility. It's women's wellness, it's fertility assessments, male fertility assessments, IUI, IVF, egg freezing, everything under the sun. It's amazing. So being able to kind of go ahead and speak to employees from a place of authenticity about what it's actually like in there, what we experienced, is really helpful. So it's just been overall amazing.
Yeah, thank you, Hannah. That's what we heard, right? If you have the opportunity to listen to the member population, we know that more than 80% of the time, members prefer a female clinician. And so, historically, when you think about healthcare, you think about an older white male sitting behind a mahogany desk, and his degrees are on the wall, and the walls are white, and the desk is mahogany, and everybody's nodding their head because every doctor's office looks exactly the same. But that's not a good patient experience. The patient is intimidated. And if 87% of healthcare decisions are driven by women, and we know women want to see women doctors 80% of the time, that's the knowledge we use to build Kindbody. We also are not naive to think that all doctors are not only should be women, but they shouldn't all be white either. And so we have African American, we have Middle Eastern, we have, our doctor population mimics our member population, and we're very sensitive to that. And so you build an environment and a member experience around the employees' needs and around the feedback from the employers. And if you're an insurance company or one of these middlemen, not only is there added cost and kind of this breakdown in communication, but they can't effectuate change. You're still going to be going to that same older white male with the degrees on the wall and the mahogany desk. Like, you can't effectuate change like you can once you're really in the doctor business. And I think the things that we know today too is your employee population is highly transient. And so we see Kindbody members who will start their cycle in New York and then go to Los Angeles on business. And they talk about that member experience, about how it being so seamless. All of everything that they see is in the palm of their hand. So we have our own proprietary technology, our patient portal, our EMR. And that's another thing that we take great pride in. Again, we had the advantage of a 10-year head start and all of this feedback from this member population. And then we encourage Hannah and our other customers to really be a team member with us and an early adopter. And you even talked about how you love being new and how you love adopting new things. And so we really encourage and we partner with Buzzfeed to communicate when we get things right, but really most importantly what we can learn and what we can improve on. But you may want to talk about Buzzfeed and how you think about adopting new benefits and being an early adopter.
It is very important to us, especially as our population is so heavily millennial based. We kind of have to run sometimes to keep up with the trends and make sure that we're adapting with them and providing benefits for them that they may need right now or they may need in the near future. So that sometimes looks like looking at reading different articles and saying, oh, what's coming up soon? And it might just be a sentence here that, more and more companies are looking for fertility benefits. So then we say, oh my goodness, well, we have a whole bunch of millennials, and we have our Buzzfeed group called Playful, which is for our parenting millennial group. And, we want to make sure that we're reaching them. That's our biggest population right now. So to kind of make sure that we stay ahead of the trends, to be competitive in the market, we're kind of always looking to flex our benefits to make sure that we're touching as many people as possible. And when it comes to the parent spectrum, being able to kind of really constantly broaden what that means is really important when it comes to keeping up with trends and being competitive in the market. Because so often it's a bit siloed. Okay, well, if it's a fertility benefit, well, it's probably just for women. Well, actually, no, 50% of the time it's for males as well. So can we offer something that touches male fertility assessments, individuals and their spouses, people new to the city who aren't quite ready but just want to learn more. So this actually is able to kind of touch on everything, which makes us kind of a little bit ahead of the curve when it comes to parent benefits in the market.
Yeah, I think that's right. I mean, and we took that early feedback to heart. So when we think about direct contracting, our value-based case rate is across the country. So when you implement a new benefit, historically, you had to pay the clinic in Texas one rate, and even within Texas, you had 25 different rates based on Dallas and Houston and Austin. We contract the same case rate across the country, which just means for the employer that's adding a new benefit to keep it easy to implement. The other thing that you mentioned is being able to think about offering those benefits the minute you identify a gap in coverage. You started 1/1, but it is actually very, very easy to offer an egg freezing benefit and add it on at any given month, at any given year, because we know the number one thing that affects the member's fertility is simply age. And so waiting, if it's March now and you waited until 1/1/21 to roll out a fertility benefit, you're really doing a tremendous disservice to your member population by asking them to wait 9 months. So you can put a benefit in really easily. It's easy to implement. Instead of all these various point solutions, like you mentioned, Hannah, it's an end-to-end. It's one solution, and then it's one rate.
And actually, that reminds me, when it comes to just reaching as many people as possible and making sure they feel heard and their questions are answered, when it came to implementing, we actually were able to, we're having Kindbody come on site to give a full presentation about not only what they offer, what the differences in their services are, but also just answer any questions. We had about 50 people within the first 2 days sign up. That's how many people are thinking about it and don't know who to turn to ask these questions to. So being able to kind of provide that for Kindbody to come on site with a full presentation and say, this is who we are, we're a few blocks away, this is what we provide, and whether you want to stop in for an assessment or a quick chat, or if you want to ask your questions now, we're here to help answer those questions. And it's great for everyone. It's great for Kindbody to hear what those questions are. It's great for employees to get answers that, maybe they didn't even know who to turn to at first. And it's great for us as benefits professionals to see, yes, where those gaps are, what the common questions are, and create that FAQ to say, okay, here's what everyone's asking, so here are the answers. On top of that, we're also doing on-site blood collection for AMH analyses. So we're pretty excited to be able to say, okay, well, yes, we do fertility assessments through Kindbody, and actually you can have one on-site at Buzzfeed right after the presentation. Just sign up here. So it's so innovative and amazing.
Again, it's a solution that's driven by member needs, right? And if you can bring healthcare to the consumer, that's their preference. Certainly when I buy make healthcare decisions, I would much rather the provider come to me than me having to go to him or her. So it does just make sense. We mentioned the New York State mandate. The mandate covers, again, 3 IVF cycles. Again, what's notable is the mandate does not cover egg freezing for social reasons, which was the kind of the request from your team. It also inadvertently discriminates to same-sex male couples. Unfortunately and embarrassingly, surrogacy is illegal in the state of New York, and that means that same-sex male couples in New York have to go to California or other states to seek treatment. And so what you see and what Buzzfeed has done is done a wraparound to be able to help populations that were inadvertently left out, or maybe intentionally, but in any event, there were member populations that you heard a lot of requests from that don't fall into this fully insured benefit. And then what we're seeing at Kindbody is when you are self-insured, they're now trying to keep up with the fully insured. So for self-insured employers who have not historically had a fertility benefit, they are rapidly adding IVF, IUI, same-sex egg freezing benefits just to keep up with the fully insured patient population. And we've touched on a little bit of this again about why Buzzfeed chose Kindbody. The convenient locations, again, we handle all of the care coordination. You mentioned it, thank you, Hannah, that it's intentionally does not feel like a doctor's office, non-discriminatory. These are 2 of our clinicians here. This is Dr. Meredith Brower that runs our Los Angeles location. And then she's coupled she's to the right. Dr. Lynn Westfall is our Chief Medical Officer. She joined us full-time at the beginning of last year after 23 years at Stanford University. So again, high quality care, very experienced clinicians. None of our clinicians have fewer than 10 years of experience in the subspecialty of reproductive endocrinology and infertility services. And they're from leading academic institutions, Mount Sinai, Stanford, Brown University. So, and again, just really thoughtful when it comes to member experience. This is Dr. Nicole Brown. Again, no white jacket. If I don't tell you she's a doctor, you're like, oh, she looks warm. And now she would do your egg retrieval. She does your transfer. But we think, she also could be a patient, right? it's fun when the doctors mimic the patient behavior. It just puts the patient at ease instead of this kind of subordinate relationship or this intimidating relationship. We want you to feel like we're on this journey with you, and we didn't come up with that idea. Again, if you poll member population, that's what the member preference is.
Great.
Again, at a minimum, our costs are 30% less than kind of the national average. In some cases, you're going to see 40 to 50% cost savings. True accountability, that's the other thing we heard from the employer population. They want to see real-time claims analysis. They want to see return on investment for their dollars. So we have an employer dashboard. Again, once you're in the doctor business, you can control for cost. If you're the middleman, it would take time and a tremendous investment to integrate with the various EMRs of the fertility doctors. And today, 1/3 of all fertility clinics are still on paper charts, making it almost impossible for any carrier or any system to be able to integrate with paper charts. So again, you see this member first and employer first solution. I think, again, at the very end of the day, we feel good about the path we're on at Kindbody because every single decision we make is patient first. So 95% of our patients would strongly recommend us. And then we mentioned this, but you have Buzzfeed members primarily in the 3 markets we serve, but you also have Buzzfeed members spread around the country who are working remotely and are journalists from home. And so in addition to our 3 locations, we have another 72 locations around the country. These are partner clinics. What we do is help message to the member of yours in Dallas. You're going to get a very similar patient experience in that all of the number one credentialing criteria to be in our network is that you agree as a clinician that the patient comes first. Some doctors agree with that, some doctors don't. To be in our network, the number one thing you have to say is, I support patients, they're my first priority, and we treat them 24/7. Again, they also agree to this exact same reimbursement cost around the country. So no gaps in coverage. You do see some states. We've assured we have a guarantee for our employers that we won't have any gaps in coverage. So if you see a gap in coverage, just ask us and we'll secure a partner clinic in that area. Whoops. And then, Hannah, you did mention, but we do on-site. Again, instead of the member coming to our clinics, we're happy to come. This is Fertility 101s. We offer on-site education. The response from Buzzfeed was enormous. Again, this millennial population is more educated. They're proactive in thinking about their fertility and family building benefits, and they're just curious. We see a number of members who just want to talk. They don't proceed with treatment, but they feel incredibly loyal and grateful to their employer for even offering something, a Q&A that's on-site at location. The other thing that we do fun on both coasts, is we have mobile clinics. So we have a mobile RV that's a full-service van. It's got 2 full-service exam rooms. We can do an ultrasound scan. We can do the entire fertility treatment cycle with the exception of the egg retrieval on our mobile clinics. And then this is another one of our mobile facilities. This is our mobile van. And then that's, Hannah, what have I missed? Anything that I've missed to talk about the Buzzfeed partnership?
No, I would say that since we've rolled out, we've had such great feedback from the first day when we got just emails flooding saying, oh my goodness, I can't believe we're offering something like this. I've had sit-down conversations with employees about egg freezing and what the options are and how through Kindbody, what does that mean? What is it actually offering and what does this price mean? And to be able to kind of communicate, oh, that's what it costs. There's no hidden fees. You don't have to pay every time you go. It's going to cost you that amount of money. All the way to people saying, man, I'm in the middle of this right now. Like, why couldn't we have had this last year? This is amazing. This is great. And everything in between. It's just been really, really great to know that we really hit the nail on the head by offering this benefit. It touched so many employees, and to be able to kind of alleviate any stress that they hadn't mentioned that maybe they were keeping hidden is, everything that benefits professional, benefits team, really wants for their employees, able to say, we're offering this because we want to make your life both in the office and out of the office better. You want to make it stress-free. We don't want you having to worry at work, out of work, about hidden fees, about, how am I going to get through the next few months with cycling and going to work. We have all that for you. So be able to touch so many employees and their spouses, which is a big point too, is that we cover both employees and their partners. It's a huge deal, and it's gone over really, really well so far.
Yeah.
So thank you.
Yeah, thank you, Hannah. Thank you, Buzzfeed.
Of course.
We're almost out of time, but are there any questions from the audience?
I was wondering, because you're in global and this is the fertility industry, like our company is in Canada as well. Can you explain a little bit about that?
Yeah, we have to be global. We know that. Canada is easy to solve for. It's very easy to solve for because it's on North America. So by 1/1/21, we will have a global solution. What's important again is the regulatory and laws change and vary by country. So the experience of our clinical team as well as our business team, there will be a global solution by 1/1/21, and Canada could be ready as easily as 7/1/20. You're welcome. Other questions? Yeah.
Thank you. And this is on a more personal note, but how do you interact with other benefit plans if it's like not covered by the current one and they're in transition, looking for a fertility type of benefit to add to the company?
Yeah, it's an excellent question, how Kindbody integrates and partners with the carriers. The best news is we're doctors, and so we're in network. We are in network with the 6 largest carriers here in New York and the 6 largest carriers in California. And so today you could come into any location, get your blood work, your ultrasound. A lot of those costs are covered through your major medical. So again, when you're patient oriented, we're going to help you defray cost and push to major medical as much as we can. We'll help you look at what riders and what other add-ons or wraparounds that you have related to your fertility benefits. But historically speaking, again, it was a tough process to navigate because if we weren't in network, what would happen is you would have to pay the clinician directly, and then you would have to submit for a reimbursement to your employer. That just doesn't happen at Kindbody. When you're in the doctor business, as a provider, we already have integration with the carriers. Any other questions? Because I know we're almost out of time. Yeah, and then in closing, I want to thank again Hannah and Buzzfeed. A particular shout out to our Kindbody team. Everybody knows we're going through a difficult time globally right now, and our clinicians are prepared to serve you. Our clinic here in New York, our clinic in San Francisco, in Los Angeles is fully staffed. There's a lot of anxiety around healthcare right now, and I think the biggest thing is when members have questions, is somebody else answering that phone. And so the big shout out today again goes to our customers, but really today and for the foreseeable future, our clinical team, it's super appreciative to the clinicians who are working in the healthcare industry today for the foreseeable future to really help members, employees, team members, friends, new friends, really lessen their anxiety and serve their needs. But I'm incredibly proud of our clinical team. So big shout out to the Kindbody clinical team. Thank you.
Thank you.